Welcome to The Explainer. Today, we're diving into a topic that sounds, honestly, a bit intimidating: liver cirrhosis. If you're a focused learner looking to truly understand what's happening inside the body during this chronic disease, you are absolutely in the right place. We're going to break down the science, the symptoms, and most importantly, the actionable paths to management and healing.
I want you to picture a bustling, high-stakes factory. What happens when the essential workers in that factory are slowly replaced by rigid, unyielding cement? What happens when our body's ultimate filter, the vital organ responsible for keeping our blood clean, our energy stable, and our digestion running, becomes clogged with permanent scar tissue? Well, that is the exact fundamental question at the heart of liver cirrhosis. Here's our roadmap for today. We'll meet your liver, track the path to scar tissue, go over stages and symptoms, look at diagnoses and serious complications, dive into medical and surgical treatments, and wrap up with management, lifestyle, and a healthy dose of hope.
Section 1. Meet your multitasking liver.
Okay, let's dive into this. Before we even touch on the damage, we really need to appreciate just how heroic this dynamic organ is. Your liver isn't just some passive filter. It's actively detoxifying harmful toxins and breaking down medications. It produces bile, which you absolutely need to digest fats. It's regulating your blood sugar and cholesterol levels. It's even manufacturing vital proteins like albumin and the exact clotting factors that keep you from bleeding out from a simple paper cut. When we talk about liver damage, this entire incredible resume is exactly what's on the line.
Section 2. The path to scar tissue.
So how does this incredibly resilient factory actually start to break down? We'll enter the villains of our story: chronic injury, inflammation, and the resulting fibrosis, which is just the medical term for scarring. It all starts at a microscopic level. First, repeated injury damages the healthy liver cells, or hepatocytes. This constant injury triggers step 2, inflammation. And that inflammation activates specific cells called hepatic stellate cells. Now, instead of helping, these activated cells go rogue and start overproducing collagen. As that collagen accumulates into rigid scar tissue, it creates fibrous bridges that permanently alter the liver's architecture. Basically, the healthy workers are being walled off by concrete.
Continuing this step-by-step pathology, the liver actually tries frantically to heal itself here. It creates what we call regenerative nodules. These are little islands of surviving tissue trapped inside the scar tissue. But because of all this structural chaos, normal blood flow through the liver gets severely obstructed. Think of a major highway suddenly reduced to a single dirt road. This backup of blood creates immense pressure, leading to portal hypertension. And ultimately, as the tissue turns to scar and blood just can't get through, the liver's function progressively and dangerously declines.
Now you're probably wondering, what causes this constant injury in the first place? Obviously, heavy alcohol consumption comes to mind for a lot of people, but it's far from the only culprit. Chronic viral infections like hepatitis B and C are massive drivers worldwide. We are also seeing a huge, concerning rise in MSLD. That's metabolic dysfunction-associated steatotic liver disease, which is closely tied to obesity and type 2 diabetes. Throw in autoimmune disorders and genetic conditions like hemochromatosis, and you realize there are actually many distinct pathways that can kickstart the scarring process. Section 3. Recognizing stages and symptoms.
So how does all this silent microscopic damage actually show up in a person? There's a really stark contrast between the two main clinical phases of this disease. First, we have compensated cirrhosis. The liver is definitely scarred, but it's still compensating, working just hard enough to perform its core jobs, which often leaves the patient with zero obvious symptoms. They might not even know they have it. But then comes the tipping point: decompensated cirrhosis. The factory has finally failed to keep up. This is the highly dangerous phase where life-threatening complications emerge and specialized medical care becomes absolutely mandatory.
Looking at the specific symptoms, it's wild how subtle early warning signs can evolve into severe systemic failures. Early on, a patient might just feel deeply fatigued, weak, or maybe they lose their appetite. Things that are really easy to just brush off as a long week. But as the disease advances, the body's systems start visibly failing. Bilirubin builds up, causing jaundice, a yellowing of the skin and eyes. Fluid leaks into the abdomen, causing severe swelling known as ascites, and toxins that are normally cleared by the liver end up reaching the brain, causing confusion and cognitive decline, a condition known as hepatic encephalopathy.
Okay, I want to pause for a second and be incredibly direct with you. These next signs are not wait-and-see situations. Vomiting blood, passing black, tarry stool, sudden severe confusion, or a high fever in a cirrhosis patient.
These are huge glaring red flags. They are life-threatening emergencies. If you or a loved one ever exhibit these signs, you must seek immediate emergency medical care. They often indicate a catastrophic internal bleed or a severe rapid infection.
Section 4. Diagnosis and serious complications.
That urgent clinical reality brings us to how medical professionals identify the damage and manage the severe fallout. The complications of decompensated cirrhosis are essentially a domino effect from the structural damage we talked about earlier. Because blood flow is blocked, pressure builds up in the portal vein. That's portal hypertension. This pressure literally forces blood into smaller, really fragile veins in the esophagus, creating varices that can rupture and bleed. That same pressure forces fluid into the abdomen, creating ascites, which can then become fatally infected. On top of all that, cirrhotic livers carry a significantly higher risk of developing hepatocellular carcinoma, which is a form of liver cancer. To figure out the stage of scarring before those severe complications hit, doctors use a genuinely incredible tool called a fibroscan, or transient elastography. Let's demystify this for a second. Instead of a traditional invasive liver biopsy where a needle takes a physical tissue sample, a fibroscan uses specialized sound waves to literally feel the stiffness of your liver. Because scar tissue is naturally stiffer than healthy tissue, this totally painless ultrasound gives doctors a highly accurate measurement of the degree of fibrosis you have.
Section 5. Medical and surgical treatments. So let's say a fibroscan confirms cirrhosis. What's the game plan? How do we fight back? Well, while we can't easily undo that concrete-like scarring, modern medicine is incredibly well equipped to manage the fallout. The crucial point here is that our treatments are highly targeted at specific complications. We use diuretics to help flush out that ascites fluid buildup. We prescribe medications like lactulose to help the body excrete the brain-clouding toxins. To prevent catastrophic bleeding, doctors use beta blockers to lower portal pressure, or they can use an endoscope to go in and actually place tiny rubber bands around those swollen esophageal veins to tie them off. And for really severe pressure, they can perform a TIPS procedure, literally creating a bypass shunt through the liver to reroute blood and relieve that dangerous bottleneck.
But, there comes a point where the factory just completely shuts down and medications aren't enough anymore. When end-stage liver disease or complete liver failure occurs, replacing the entire organ through a liver transplant becomes the life-saving final option. This is a complex, major surgery reserved for eligible patients where a healthy donor liver completely takes over, essentially offering a brand new lease on life.
Section 6. Management, lifestyle, and hope.
A transplant is the final line of defense, for sure. But for the vast majority of patients, living with cirrhosis is really about highly practical day-to-day management. And this brings us to a deeply hopeful part of our explainer, the things patients can control every single day. You might not instantly associate physical therapy with a liver disease, but physiotherapy is an absolute game-changer here. Cirrhosis aggressively causes muscle wasting, known as sarcopenia. By working with physiotherapists on tailored aerobic and light resistance training, patients actively rebuild their strength, improve their balance, and vastly reduce their fatigue. Building physical strength is a direct, highly measurable way to combat the systemic toll of the disease.
And it's not just about hitting the gym. Nutrition is equally critical. In cirrhosis, food literally is medicine. The damaged liver struggles to store energy, meaning a patient can enter a starvation state very, very quickly. That's exactly why frequent, small meals are recommended, along with a totally crucial bedtime snack, usually a complex carbohydrate or protein. This prevents the liver from entering a fasting state overnight. Combine that with strictly avoiding alcohol and limiting sodium to keep fluid retention in check, and this targeted diet fundamentally supports a struggling liver. Which brings us to a medical consensus that perfectly sums up our core takeaway today. While the scarring is severe, it is far from an automatic end of the road. With early diagnosis, aggressive treatment of whatever caused it in the first place, a really dedicated exercise and nutritional regimen, and careful medical monitoring, patients can dramatically alter the trajectory of this disease and secure a high quality of life.
Think about it. Your liver works tirelessly for you every single second of the day, filtering, building, and protecting your entire body. Knowing what you know now about the delicate balance between healthy function and irreversible scarring, will you take the proactive steps today to protect, monitor, and support your body's ultimate multitasking factory? Thank you so much for joining me on this explainer, and here's to prioritizing your lifelong health.